Hello, welcome to Adapt NCLEX. Today we're going to talk about two of the board favorites, celiac disease and irritable bowel syndrome. I call it board favorite because they look the same, symptoms are almost the same, medications are not that obvious, intervention are almost the same, and it's very confusing. Sometimes you don't know which one you're talking about. So today I'm going to give you the key information that you need to know to feel confident to answer these questions. So let's get to it. What is celiac disease? Very, very interesting disease process. Um, Basically, like as you know, I like pathophysiology. So we talk about what causes the problem, and then we can make a treatment. So this is an autoimmune disease. That means your body is reacting against its own. And why? Because you eat something that has this foreign body in it, gluten. Your body is reacting against this gluten in diet. There's many food that has gluten in it, therefore you react with it. It doesn't like that. And when it does that, it destroys the main structure that is involved in absorbing food, which is a villi in the small bowel intestines. These are finger-like projections that absorb food from the intestines to the hepatic system, portal system, so that it can go into the rest of the body. They're responsible for that. So these autoimmune reaction will destroy these villi such that your intestines will become like flat. He has no ability to absorb anything. You eat and the food just run out of you if there's a gluten in it. So if there's gluten in it, this is what is going to react. This severe reaction, ongoing reaction will occur. And that is all that happens. It's an irritant. You can think of it as irritant. That's the pathophysiology. And as you know me, how? If you find a pathophysiology, then you find signs and symptoms. If I'm not absorbing any of the food that I'm eating, well, I'm going to have diarrhea. And this diarrhea is not just any diarrhea. Everything I eat that will come out. So they have very large volume diarrhea. And because I cannot absorb anything, and most of them fat, if there's too much fat in your stool, well, you smell like that foul smelling, foul smelling diarrhea. And since there's too much fluid, basically food in the bowel, they get bloated. And then with the bloating, they get crampy abdominal pain. Does that sound familiar? It's like you went to McDonald's and you go and eat some food, and then you have this. We've had this multiple times. How do we know we have celiac disease? Well, it's very common. That's why your board like it. It's a board favorite to trick you. Like, hey, these conditions are easy to trick students with. It's not like they want to trick you. They want to know if you can critically think and be able to find the key features. So that's what we have. So we know signs and symptoms. Well, we can use it to intervene, as I say all the time. Treatment. So how do I treat this? Well, get rid of the gluten, man. So gluten-free diet. Is that easy? No. There's a lot of food in the market that is marketed as gluten-free, but most food, a little bit of gluten in it. So you got to be looking for it. So it's a very complicated and difficult to manage problem. Patient will tell you they've done everything they have and they're coming back. Well, there's a problem. They still have not eliminated gluten in their diet. So if anybody come in with gluten celiac disease and they say, I've done everything, I'm still having this problem, ask them, what did they eat last night? Then you can figure out whether that thing has a gluten in it. So gluten-free diet. Then you go with your management. So my management, I call it celiac disease, rest in peace, bro. So Somebody is rest killing bro. So who is that? So bro is what? Barley. They should avoid this. They should avoid rye. They should avoid oats, and they should avoid wheat. So they should avoid all these food products: barley, rye, oats, and meat and wheat. But then, who is doing the killing? Rest in peace. So is rest in peace. So they can eat rice. Okay, they can eat corn. That's the I, and potato. So rest in peace means the rice, corn, and potato. They can eat it, bro. They cannot eat it. But is that easy to do that? No, it's not easy to it's not easy at all to stick with it with this diet. It's not easy because, like I said, there's a lot of food that has there's a little bit of elements, small element of that. So there has to be a lot of teaching. So you, the nurse, you do your teaching. So your teaching is very important. So you do your teaching. What kind of teaching you tell them? Number one, be very vigilant. Read every label. Read labels like you're trying to lose weight. Read label to the T. You have to cross everything. Make sure there's no single routine in the diet. When you go and buy processed food, you have to read everything. There's some food that still has, even though we don't have, they don't call it barley, rye, oat, and wheat. Well, they have gluten in it, like hot dogs. So when you go out to the picnic, stay away from it. Some chocolate also have gluten in it. This is why it's very difficult. So like chocolate bar and everything, you go and eat, then boom, you get sick. And soya sauce, okay, they don't call it like that, but it has some gluten in it. So the patient get confused. They go buy some spicy food he eat, even though there's no gluten, then boom, he gets sick. So you have to really, really tell them these are the main things, but there are other things that also has gluten in it. So you got to be looking for them, even if they put it in a sandwich. Every little portion of gluten is a problem. And this one too, malt. Malt is fine in a lot of drinks. And so they have to read the label adequately as much as possible. And guess what? This is your SATA question right there. They will give you a bunch of food and say which one can they eat. Then you got to figure out. But if you know this, it's like, oh, this is straightforward. I'm looking for barley, rye, oat, but there's other things that they can get. You go outside and buy hot dogs. Well, guess what? You're going to get sick. In the teaching, read labels and everything. Okay, so those are. There is another thing too you got to teach them, which is very important. With all these chronic inflammation, your body doesn't like that. So they eat, everything comes out. So they have a lot of diarrhea. So they have dehydration. So in the form of more nutrition. So they cannot absorb everything. So more nutrition. So you got to give them, you got to watch them for more nutrition. They get like, they will be underweight. They don't grow well. They don't have the micronutrient to grow well. And the serious one is lymphoma. Somebody say, how is that happen? Well, in your small bowel, there's a lot of lymphatic and lymphoid tissue that help with immune response of your body, immune response of the gut. That's why your gut is a very immune response area. That's why when you have sepsis, it's really bad. Therefore, if they continue to have this inflammation back and forth, you get hyperplasia of the lymphatic system. I don't want to go into detail, but they develop lymphoma, so they can get cancer. So it's not just diarrhea, chronic problem become this. So we need to avoid that. So you got to help them stop this cycle. I told you they are foul smelling diarrhea because they cannot absorb fat. And this is where you connect your pathophysiology and connect the body system. It's like cystic fibrosis patient who also cannot absorb fat because of the pancreas doesn't secrete an enzyme. They also have foul smelling stool. And what do you do for them? Well, you need to give them fat soluble vitamin. So ADEK. So don't forget that. ADEK, they need fat soluble vitamins. And then they also need iron because of the small bowel. Iron and folic acid is absorbed in the small bowel. We don't have to talk into too much about it, but these are the key things. Very easy, straightforward. ADEK, they need vitamin, they need iron and folic acid. So if they are anemic, don't be surprised because they cannot absorb that. If they eat this thing, fatty food, and they have diarrhea, yeah, they cannot absorb it, So this is everything you need to know in a very short time for celiac disease. And if they give you a SATA question, you just go back to your bro and some exception like this, what they need to do, and who is going to keep bro is rice, corn, and potato. They are the one doing the job. So that is all. Now let's look at his friend. His friend, what is going on with his friend? His friend is almost the same, but there is no autoimmune disease associated with it. This is not autoimmune. It's also more absorptive, so more absorptive disease. Okay, but what is going on? Your body absorptive function in the small bowel is affected, such that there is alternation. So alternate. They have constipation some days, and then some days they have what? Diarrhea. So they alternate back and forth. Some they can have constipation for like 3-4 days. Then after 4 days, explosive diarrhea for a week. So it's a cycle back and forth. They don't know what happened to them. So that's what happened. Back and forth, back and forth. And so this is the underlying problem. Diarrhea, constipation, diarrhea, and it's due to the bowel function that is affected, and the mobility, okay, the motility of the bowel affected. So you got to control the motility. Sometimes it doesn't move, sometimes it contracts too much, and they have diarrhea. And so you can figure it out. So you say signs and symptoms. Well, I told you signs and symptoms is diarrhea and constipation in alternative form. Because of this, we have, they call it IBS, that is irritable bowel syndrome C. When you see that, that means constipation is the predominant. So you have more constipation than diarrhea, or ibs-c, ibs-d, irritable bowel syndrome with diarrhea as the most prominent. So they have more diarrhea than constipation. What did they think is the problem? So risk factor, okay, that's your SATA right there. They think it may be some stress. Stress change your body dynamics, the autonomic nervous system, and then make the cholinergic effect take over, or sympathetic, basically back and forth, alternating. And therefore, the stress play a big role in this problem. We think there may be stress is number one, the problem. If they don't find stress, they will think you have mental health problem. So sometimes mental health diseases can affect the regularity of your bowel. And so those are the two main. So you can use this, okay, the pathophysiology and the risk factors to teach them treatment and management and everything that they have to do is based on that. That's how you simplify information. I know risk factor is having stress and some mental health, and this is alternating the bowel, basically go crazy and contract too much and then slow down. So management, okay, how did you manage them? Okay, so what you need to do is they need to reduce their stress. So reduce the stress. And that is a broad statement. What can they do? Well, How do you reduce? Whatever you do to reduce stress is acceptable when you see it in your question. You can do yoga, you can do exercise, you can go dancing. I mean, uh, they basically modify their stress level. I don't know how to call it, but that is anything that will basically coping skills. I guess that's the right way. Coping skills about things that so that they don't go into stress too much. Okay, so those are the things, the main thing, whatever they're going to do to reduce their stress. And this is how test taking skills is very important. You can't know everything. I tell you, don't memorize the symptoms. They're going to reduce stress. If you give you answer choice, that will reduce stress. I'm picking it. I don't know what it is, but if I don't do it at all, so for us, it's reducing stress. It's a good answer. It's a SATA question. That's what it is. It's answering the questions they're asking you. Okay. If they have mental health problem, then treat it. Okay. Treat it. You need to treat it. Then there is other adjuncts. Okay. We call it adjuncts treatment that can help with this problem because we don't know true things that can help. So you can do so many things. Some people like probiotic, and probiotic basically change the biofilm. Okay, that means the bacteria level in your gut, and they improve it, and they basically regulate the bowel function. We don't have to go into details about that, but that's what they can do to do that. Okay. Then you come to the tricky part, like we did with the celiac. Now, food. This is the hard one. It's the hard one that you have to like be careful which one is which. Okay. It sounds like celiac, these people have constipation and diarrhea. So they also can get bloated. Okay. They have diarrhea. When you have diarrhea, you get bloated. When you have constipation, you have cramping. So they have both symptoms of somebody who is having diarrhea, like celiac pro, and constipation, like somebody who's not having bowel movement. So you want to avoid gas forming. So gas forming food, like somebody with colostomy, okay, or ileostomy, sorry. So like banana can form a lot of gas. Like cabbage, they can't eat it. It's gas forming. So you put it in the groups to simplify it so that you don't have to memorize all this. Just say gas forming food. So if you remember this gas forming, yeah, onions are not good. Okay, onions. Then I call them carbs. So COBB. So they have gas forming. You have banana, onions, and then cabbage. Those are the gas forming. They should avoid that kind of food. The next thing they can avoid is irritant. Okay, they can irritant in this thing because that can irritate it gives them a lot of cramps. And the common irritant, there's a few irritants you should avoid. Every time you see in your answer choice, it's a no-brainer. If I see caffeine, I'm not picking it. If I'm eliminating it, oh, it's not a good answer. If I see alcohol, I'm eliminating it, it's not a good answer. Smoking, I'm eliminating it, it's not a good answer. These three things, whatever the disease process, never pick them, no matter. They're never good. Okay, I know everybody drink coffee, but caffeine, it's okay. So it's not good. It's an irritant for them. ETOH and smoking. Okay, these are all irritants that will make them have diarrhea and constipation. So that's one group of them. And then there's this one always. I mean, in medical school, we always talk about it. I still use it in my patients. So is they should avoid fat man's diet. I know you've heard that before. Fat man's diet. It's a long name. I don't have to bore you guys, but it's a fermented. That's the F. Okay, fermentable oligosaccharide. These are starch. The starch is divided into oligo, mono, di, and tetrasaccharide. Basically, the combination of the glucose molecule. It doesn't matter. Anyway, it's a fermentable oligo di. Okay, that's di. The M is mono. So oligo 1, di 2, mono. Okay, monosaccharide and polyols. These are a group of complex carbohydrates that they should avoid in their diet. And I'll just listed them for you. It's honey, you can't get honey. It's complex. Syrup, you see why this is the problem? You can't eat pancake anymore. Wheat, you see, you cross over to celiac disease and fructose. Guess what? Every time you have juice, there's one or two of this in the juice. Honey, syrup, or fructose. Well, so what are you going to eat? So these people too, they have to meticulously be checking. They have a food diary to help them avoid this. So Fadman's diet is that they should avoid these kind of foods. Okay. Then I forget about some of the irritants. I don't call them irritant too much. Spicy food is an irritant, basically. You will give them a dairy product. Okay. So there's a bunch of it. That's why irritable bowel syndrome is a little bit difficult, and fatty food because of the diarrhea. So there's a bunch of food they have to avoid. So it's very, very painful for them. So somebody will say, you're listing so many things. It just came into my mind. But you're listing so many things. What else can they eat? You can get the answer from constipation. Okay. Because of the constipation, you can keep them in the uniform form. So the main diet treatment, okay, that they use is mostly high fiber diet. So high fiber. So anything that has fiber, you can tell them like grains, they can eat grains. They can eat like legumes, okay, nuts. They can eat some fruits and vegetables, you know. So this is a classification. So you don't have to remember all of them. Just say high fiber diet is good. Okay. They can also eat some protein. Protein is good for them. And bread and bland food. Okay. So protein, bread, brown food, and a high fiber diet. This is what these people need. They should not eat anything, all the one we listed. So this is what IBS people should stay on. High fiber diet, protein, bread, and plants. They should avoid all these irritants. So they're very painful. They're always stressful. And so that's why the main thing is to help with their stress level. Reduce this as much as possible. This is the number one cause. So if you get this down, you go in. Luckily, there's a medication that you can use it to slow down the bowel. So these people are a little bit lucky, okay? And this is the medication, Dicyclomine. You've heard it before. You've taken some before. And then it's very good medication. It's something you should know in your pharmacology. They like it. The board also favor it. Why? Guess what? It's an anticholinergic. Your bowel move because using cholinergic effect. This is an anticholinergic. So you block the cholinergic effect and you slow down the bowel. So you slow them down. And you see what I've done? I give you the pathophysiology, the way you function, and therefore I can figure out what is its side effect or when should I avoid it. Okay, anticholinergic. So it slow down the gut. Okay, that is the main function. Therefore, if you already have a bowel obstruction or you have ileus, paralytic ileus, you should stop it. You never even try it because that's what anticholinergic does. What it slow your gut down, it slow your bladder down, it worsen your glaucoma, it dilate your pupil, right? It decrease it make your mouth dry. Those are all things it should be just coming out of your mouth. Well, this is what I see. So when they ask you your question, which patient, what should you intervene? Well, if you already have bowel obstruction and he has irritable bowel syndrome, I'm not going to give him dicyclomine. So we're doing pharmacology. You see, we started with this, now we're going to pharmacology. So you should avoid that. Okay. It gives dry mouth. Okay, that's symptoms is not that bad. So this is your prioritization. Now you're thinking about it. Dry mouth is okay. We can let them chew sugar-free candy. I can take care of it. Glaucoma, no, that's bad. Okay, this is the bad one. So you got to intervene. If I'm an examiner, I'm going to give you somebody who has glaucoma. Okay, you'll give you somebody who have glaucoma. Okay, then the last one is urinary retention. So which you got to pick your poison. Okay, you got to pick your poison when it comes to prioritization. You got to look for my B sharp prioritization, and you see, so you have bowel obstruction, you have dry mouth, you have glaucoma, and you have acute urinary retention. Which one you want to choose? Well, for me, I think this is dangerous. No, glaucoma is the more dangerous in these two. Urinary retention, we can put fully in them easily, so we can help with that. But this obstruction, if they already obstructed, you causes severe bowel obstruction. If you have close angle glaucoma, you worsen it, and therefore they lose their eye. It's a pain that will let them lose their limb, life, and a high sight. If you watch my prioritization video, therefore glaucoma. So when they give you a question like that, if I give you somebody of Dicyclomine, which one should you report to the doctor? Well, if he has bowel obstruction, I'm going to obtain it. If he has glaucoma, I'm picking them. But if none of this is there and urinary retention, yeah. So the order of preference is, I would say, glaucoma, then bowel obstruction, then urinary retention, and then dry mouth. So it depends on the answer choice. Don't memorize it. Just think about it. Which side effect is more serious? I think glaucoma, worsening somebody glaucoma, they will lose their vision is bad. You know, then followed by bowel obstruction, you have ileus, then urinary retention before dry mouth. So this is everything you need to know about this problem. You see, I try to put them together and see the key features of them. And so let's try a quick question. A client, so as usual, test taking strategy. Okay, we can use test taking strategy. A client, so you read this as a SATA question. If you listen to my SATA question, SATA how to answer SATA question. So if you listen to my, there's a video on my YouTube channel. It's about how to answer SATA question. I have a technique that I think is very awesome. You should try it. You can answer any every SATA question. This is just it's not a be all, and then basically just tell you how to focus. So first is to ask the question, what is being asked, and second, look at the case. Okay. Third, then find the buzzwords, then rewrite using the buzzwords, and then make a choice and move on. So that's the steps we're going to use. So how do you ask? Is you look at the last portion of the sentence. Which of the diet the nurse should include in the teaching? So our ask means diet in the teaching. Okay. What is the case? Then you read the rest of the, because you want to know the scenario. Where is the patient? Is he at home? Is getting a phone call in the emergency room or in the hospital? A client with prior diagnosis of celiac disease. So he has celiac disease, was being discharged after acute exacerbation. Which of the diet should the nurse include? So we are in a hospital. He had celiac disease and he has exacerbation. So he's going to be discharged. What are our buzzwords? So our buzzwords is the keyword celiac disease. Okay. And what are we doing? Diet and teaching. So 3 keywords. I use these 3 keywords. I've broken all these 4 lines into that. All this is unnecessary. The diagnosis is celiac disease, is being discharged, and then we're talking about all this being um, being discharged because of the problem. He had a recurrence, and then we are talking about diet and the teaching. So these are the 3. So we rewrite the sentence means somebody with the celiac disease, and we have to provide teaching at discharge. Then we make our choice. We're going to evaluate each answer choice using these 3. We don't compare those 2, and we just make a decision and we move on. So French fries. Can you eat French fries? You tell yourself, well, celiac disease, you cannot eat, bro, but you can do rest in peace. But there's other one like the other things that they can eat that is not in this thing, they should avoid in the bra, like hot dogs, soya sauce, chocolates. They should. So French fries, it's okay. Oatmeal. I see the oat here, so no, you can't eat this. So this is wrong. Rice, yeah, rest in peace. Rice can kill him, so I'm good with this. Potato chips, rest in peace. P, you can eat potato chips. Vegetables, yeah, it is not part of the hot dog, chocolate, soya beans, and malt. So vegetables is fine. Banana cake, well, I don't see it here, so I'm good. You see, but banana, what does banana do? If you look at IBS, banana people, they hate. It's not good for them. IBS because it's a gas forming, so they can. This is so that's how they can confuse you. IBS cannot eat these people banana, but celiac people can eat it. Barley leaf bread, no. So he can eat banana. Sorry, they can eat banana, but they cannot eat barley. And wheat, we already talked about it. So the right answer is A, C, D, E, and F. And so that is all between these 2 diseases. And I hope I make it clear as much as possible. Please do visit our channel and subscribe for more awesome details, content with test taking skills and strategy to pass these exams. Try to make it easy as much as possible, compartmentalize it, and expect more videos of such nature. Take care of yourself and keep charging.